while since I've made any videos, but welcome back to all my faithful viewers. I'm here to talk about health and wellness as usual, and to help my viewers to be healthy, happy, and wealthy. Okay, so today's topic will be about health, and I'm going to be focusing on my seniors today. So if there are any seniors out there, or if you know anybody who is a senior who lives in Canada, Ontario, then tell them to check out this video. And I will be focusing mainly on the deductible. And every senior in Ontario knows what this is. And if you don't know now, you will know at the end of the video what this is all about. So every August, we have to pay the deductibles to the Ontario Drug Benefits. And this is the program that is specific to Ontarians. So if you want to hear more about this, continue to watch this video. Okay, guys? So today I am going to be talking about the Ontario Drug Benefit Program. So if you hear me refer to it as ODB, this is the same thing. So if you hear me referring to ODB, that's the Ontario Drug Benefit Programs. So prescription drug cost is very expensive for most countries. And an average Canadian will spend $926 per person per annum. And this is a lot of money, especially for seniors who are on a fixed income, who they're not working anymore. So it's very challenging for this group of people. The Ontario Drug Benefit Program, ODB, is a program that covers 5,000 prescription drugs for residents in Ontario only. It also pays for your allergy shots, your EpiPen, your test strips to monitor your blood glucose in diabetic patients who are eligible. Some over-the-counter drugs are covered, such as ibuprofen and iron supplements, nutritional products, and for palliative care drugs, there's some amount of coverage, and persons who are looking to stop smoking can also get coverage for their medications. Who qualifies for the Ontario Drug Benefit Program? Ontarian residents 65 years and older, or if you're living in a long-term care home, or if you're in a home for special care or community home. Seniors aged 65 years and older. When you are 65, you will receive a letter around 3 months before your birth date. And this will let you know that you are eligible to join the Ontario Drug Benefit Program. It starts the first day of the month after you turn 65. The pharmacy will need a valid health card with your number on there to confirm your eligibility for Ontario Drug Program. So let's say you were born in September. It will kick in the 1st of October. Got it? So if you're born in January, then February 1st would be when your program will kick in. So it's automatically activated that first month after your birth date. Okay? So congratulations, you're officially a senior citizen. You're 65 years old and you qualify for the Ontario Drug Benefit Program. So how much will you pay for your medications now? As a senior, 65 years and older, you only pay a portion of the prescription cost based on your annual income after deductions and based on your marital status. So there are 4 groups of seniors. Single seniors with a yearly income of $22,200 or more. Then there are senior couples that combined income is $37,100. Then there are the single seniors with income of $22,200 or less. And last but not least, there are the senior couples with combined income of $37,100 or less. So there are 4 groups of seniors that we're focusing on. So let me break this down some more. So let's say you're a single senior. So you're a senior, you're 65-year-old, you live on your own. Your income is above $22,200. Then single senior, 65 years or older, with an annual income above 22,200 after deduction will pay the first $100 of total prescription cost each year. So this is what we do every August. As soon as August 1st starts, then you will pay this annual deductible. So it will carry through from August 1st to July 31st of the following year. And this is your deductible, that is the $100. And this is what we go through every August, that everybody's shocked and in awe when we say your bill is $100. And they're like, what? It's August already. Yes, it is August. So this applies for seniors. If your income is above $22,200, you are the people who will pay this deductible. Okay? The first $100 deductible is paid down when you fill your prescriptions. After paying off the deductible, you will go back to paying your co-payment of $611 for each prescription. Most pharmacies only charge you $411 because we give you that $2 discount. So let me repeat that. After you pay your $100 deductible, so some patients will have an expensive drug. So let's say your drug is expensive. Let's say you're on a blood thinner, those new fancy ones called like Xarelto or Eliquis. If you get a 90-day supply of one of those, it might run into hundreds of dollars. So this one drug will cost you $100. Hence, you will pay your deductible of $100 in that one prescription. If you don't have expensive drugs if you don't take expensive drugs, then it might take several prescriptions before you total that $100. So you might go this week and you pay $20. You go the next week, you might pay $30. So this will continue until you come to the total of $100. So each individual will have a different situation depending on the cost of their drugs. So the next group, if you're a single senior with income of $22,200 or less after deductions, you will pay up to $2 for each prescription drug filled or refilled, but you do not have to pay the deductible. So it is income based. So people who are of low income, if your income is $22,200 or less, so that's what we call a low income senior, then you only pay your $2 copay and you do not pay this $100 deductible. Most pharmacies will waive this $2, so you end up paying $0 for your medication, which is a good thing. Okay? If you fall in the group of seniors who are low income, you have to enroll in the seniors co-payment program by sending a completed application form. Seniors, you send in this form because I think you automatically get, once you're 65, you automatically get qualified for the ODB program. But if you know that your income is $22,000 or less, then you go online, get this form, or go to the pharmacy and ask them for a form, and you complete the form, send it in, so that ODB knows that you're a low income senior and then you would not have to pay that $100 deductible. Got it? Okay. Okay, so let's look at senior couples with combined income of $37,000 or less. A senior couple with a combined yearly income of $37,100 or less after deductions, each senior over 65 is eligible to benefit to the ODB benefit, and they pay $2 for each drug. They pay $2 for each drug and do not have to pay the deductibles. So this is another group where you don't pay the deductibles. So this is for senior couples. So your husband and wife, or you have a partner, you have a partner and your combined income is $37,000 or less. Then you would be that group that pays $2 and you don't pay that deductible. Okay? So again, you also have to apply for this seniors copay, because it doesn't automatically happen. You have to say, hey, I only earn X, so I need to apply and get them to remove that deductible portion from your file. Okay? You're a single senior, so you live on your own. You have an annual income of $22,200 or less, or a senior couple with an annual income of $37,000 or less. You must fill and send those application forms in. So I'm just repeating what we just discussed. Single senior, $22,000. Couples, $37,000 or less. Then you need to apply for this copay so that you don't have to pay those annual deductibles. Okay, so word of advice: as soon as you receive that letter that says, hey, welcome to the seniors club, then you will let them know that you are earning this amount and you can apply for the co-payment program right there, so that you go into the right program for you. All right, so that's it, guys. That's it in a nutshell summary. I hope that kind of clarified it for you. If you go onto the computer and go to ontario.ca seniors or ODB program, I think it is, then it kind of breaks everything down for you. It has a form that shows you that people who just register, let's say you registered last month, then you would end up paying that. If you registered in August, then you end up falling in that beginning of the copay, so you would end up paying that $100. The further into the year that you go, you pay less, especially for that first year. So you can go on the website and look at the form and see what I'm trying to explain to you. So if you have any questions, please put it in the comment section, and I would love to answer any questions. So it's Carrie the Chemist here. Have a blessed day. Remember to keep healthy and wealthy for this 2021. Thank you. Bye.